Good afternoon and welcome to the Governor's Interagency Advisory Council on Homelessness to Housing. This meeting has been publicly noticed in compliance with the Nevada's open meeting law. Chair Tim Robb will call the meeting to order.
Thank you so much, Ms. Freeman. We will call this meeting to order. It is 1:05 on September 26th, and I will call this meeting of the Nevada Interagency Council on Homelessness to Housing to order. Moderator, will you please call the roll?
Chair Tim Robb.
I'm here.
Senator Dina Neal.
Here.
Assemblyman Max Carter. Deputy Director Emily Testweed.
Here.
Administrator Robert Thompson.
Here.
Administrator Stephen Acroft.
Here.
Colonel Mary Devine.
Here.
The wrong
Lieutenant Christopher Garrell. Lieutenant Shatana Daniel. Sheriff Jerry Allen. Judge Mike Montero.
Good afternoon, I'm here.
Judge Christy Craig. Dr. Katrina Grisby Thetford.
Here.
We have quorum, Chair.
Thank you so much. With that, we can move into agenda item number 2, which is public comment. No action may be taken on a matter raised under this specific until it is specifically added to the agenda. Comments are limited to 3 minutes. If you're making public comment via phone, please call 1-775-321-6111, and the meeting ID is 142-618-828, followed by pound. We are now open for public comment.
Chair Rob, this is Administrator Acroft. Am I allowed to make some public comment?
Absolutely. Go ahead.
Thank you, Chair. Wanted to make this group aware that for the enactment of AB 310, we were able to get regulations passed through the Legislative Committee earlier this month. Also, with that, we have created a notice of funding opportunity, and for the 32.2 million in supportive housing funds, those are available on our resource page on our website, or if you have not received those and you're part of the supportive housing community, you can send an email to nhdgrants@housing.nv.gov to receive an application. Again, that's NHD, like Nevada Housing Division, grants@housing.nv.gov. And with that, I will yield my time.
Thank you so much. I know it's been a lot of work to get to that point, so appreciate all that's gone into it, and we're here to support you guys in whatever next steps you guys need. Is there any other public comment anybody wishes to make?
Yes, this is Dr. Katrina, Executive Director of Nevada Homeless Alliance. I just want to let everyone know that we're hosting our 3rd annual Nevada statewide conference on addressing homelessness at the Flamingo on October 7th and 8th. You can go to our website to get more information. It's going to be a full 2-day conference, all types of different topics and speakers, and you won't want to miss it. And if you guys are interested, you can just shoot me an email directly and I'll send you some tickets.
Fantastic. Thank you so much, Dr. Katrina.
Mhm.
Is there anyone else that wishes to make public comment today? Okay, hearing none, I think we can move on to agenda item number 3, discussion and possible approval of the meeting minutes from the July 18th, 2024 meeting of the council. Is there any discussion anybody would like to make on the proposed minutes? Okay, hearing none, is there a motion for approval?
Robert Thompson, motion for approval.
Thank you. Do we have a second?
Mary Devine, I will second.
Thank you so much. All those in favor, say aye.
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 Any opposed? Motion carries. We can move on to agenda item number 4, the Division of Welfare and Supportive Services Workforce Development Unit. Do we have somebody from the unit on to give a quick presentation?
Mike Yoder for the record. I believe that's me.
Yes, sir. Go ahead.
Okay. They asked me to prepare about 20 minutes on workforce development within the Division of Welfare and Supportive Services. My name is Michael Yoder. I am the Workforce Development Division Manager for DWSS. And a lot of people don't know that we actually engage in workforce development here in welfare. And I'm going to give an idea today on what the components of workforce development are in our agency, talk a little bit about our relationship with the WIOA system, and talk about what customers we serve and what type of services we provide. Starting out, there are 2 units within workforce within the agency that does workforce development, and that is the Workforce Development Unit. And I'm setting my timer here so I can hit 20 minutes and not go over. The Workforce Development Unit has the goal of lifting TANF and SNAP clients and their families out of poverty permanently by offering career development opportunities such as non-degree credentialing programs, also known as vocational training certification, as well as job readiness, holistic support, and job placement. We've been doing that to some degree for decades under the TANF NEON program. NEON stands for New Employees of Nevada. That was the Employment and Training Department. But for many years before joining WIOA, that department was mostly compliance-based. If the federal government gives you TANF funds and tells you that you are going to continue to get those TANF funds based on compliance, such as families meeting 20 or 30 hours a week, that's going to be your first goal. Although we did always take special care when we had the opportunity to help develop clients and find real job opportunities and potentially careers for our clients. And that is the goal now of the workforce development components within DWSS, is to provide workforce development services toward the goal of what the outcome is for our client and the long-term benefits. The other unit within DWSS, which is our other component of workforce development, is the Recovery Friendly Workplace Unit. The mission of the Recovery Friendly Workplace Unit is to identify recovery-friendly employment opportunities for people in recovery while providing one-on-one support to help those individuals in recovery obtain employment, work toward a career so that they can be successful in their recovery. And we work in partnership with DPBH and Foundation for Recovery on those types of services. The origins of our act to build workforce development come from President Obama signing the WIOA Act in 2014. WIOA stands for Workforce Innovations and Opportunity Act. The purpose of that act is to help job seekers access employment, education, training, and support services to succeed in the labor market and to match employers with a skilled workforce. TANF as a mandatory partner under the WIOA Act for Title IV. TANF is Title IV. And that is how we entered the scene of workforce. In 2017 in Southern Nevada, we started partnering with our workforce board, Workforce Connections, and co-located a welfare worker at the main employee NV hub on Charleston. And one of their Title I workers, WIOA Title I workers, came to the Belrose office and made Belrose an affiliate employee NV site. At the time, it was One Stop. I always have to catch myself from saying that. It's now Employee NV Hub, either Employee NV Career Hub or in Employee NV Business Hub. And out of that partnership, we started collaborating with our workforce system partners and started to see what our role was going to be through a lot of different projects that we worked on. We developed our first actual workforce development program from this, and once again, based on client outcomes and not just participation. So our administrator set up a special unit and started staffing that unit to do very specialized case management with new goals. So who do we serve, one might ask? First and foremost, our TANF and SNAP clients and Medicaid customers, anybody in poverty who is on those benefits or may qualify for those benefits. And TANF, of course, as most on the call probably knows, temporary assistance for needy families is the cash portion. And then you have SNAP, which is Supplemental Nutritional Assistance Program, the old food stamp program, and Medicaid. And we have a NEON department, as I mentioned earlier, New Employees of Nevada. So if someone comes through TANF, they automatically have to participate in the NEON program, and we get a lot of referrals from our NEON case managers to help people work toward a career. The second purpose that we serve, or customer, if you will, obviously, if we're a mandated partner, we must work with and serve our WIOA integrated workforce system partners, which in turn serves industry and economic development for the state. So without economic development and workforce development go hand in hand. Serving the needs of employers and industries helps businesses grow, entices new businesses to move to the state, and creates more and better career opportunities for our customers who are looking for a career, people who are in poverty. So when businesses grow, our individuals are able to grow in their careers and have more opportunities. DWSS in our workforce development unit were pretty instrumental in a lot of initiatives in this area. One of which I like to highlight is we were a pretty crucial player in the Mesquite Workforce Initiative, getting that group together, working with that group from ground zero. And we helped to bring one of the largest bottling companies in America to Mesquite, Nevada, Crown Holdings. And reports earlier this year, we saw over 100 manufacturing companies that were due to move to Nevada by the end of the year. We serve in-demand industries such as the health professional shortage areas. We help to recruit and train folks mostly for the entry-level positions in those areas like CNA, community health worker, medical assistant, etc. And third, I'd say the third main customer or group that we serve, or where we apply our services for legislative actions or legislative initiatives surrounding poverty and underserved populations. An example of this, a couple of examples of initiatives that we've served on was Senator Neal's Project 354, which was born out of a 2017 Assembly bill from the 2017 legislative session, which sought to reduce the disproportionately higher unemployment rates among African Americans in underserved zip codes across the county. We held many events resource and hiring fairs at places like Doolittle Community Center, Matt Kelly Elementary School, New Beginnings Ministry, Desert Rose High School, and many high schools throughout those communities where you saw double-digit or double the unemployment rate among that population than what was the state average. So we still work on these things as a course of regular business on an ongoing basis. We worked with Councilman Creer's Ward 5 Works, which targeted the high demand sectors and tried to stimulate business in Ward 5, and working together with the workforce system and working toward getting residents being able to afford access to good jobs and a living wage, with healthcare and retirement benefits and opportunities for advancement. Currently, we're working with the Workforce Board on Disconnected Youth Coalition. Workforce Connections, headed up by Workforce Connections with Workforce System Partners. There's over 47,000 disconnected youths in Nevada. These are teens ages 16 to 24 who are neither working or engaged in education. So WDU, our team, joins the system partners in a mission to perform outreach and engage this population in workforce development services to reduce that number of disconnected youths in Nevada. And we serve on a lot of other initiatives and committees throughout the state to help initiate the state plan for workforce development and the WIOA plan. We're on the governor's workforce development board, on the, actually in particular on the subcommittees such as the the strategic planning committee and the barriers in underserved committee. Just two examples. I think we're on a couple more, actually, childcare, and I forget what the other one is. But so what do we do, actually, one might ask? What are some of the services that we provide? Right now, we're in about 9 employee NV locations with our workforce system partners, and we provide verification of TANF and SNAP benefits for partnered enrollments. So before welfare was on the scene, it might take somebody a couple of weeks to qualify for WIOA benefits, and now we provide a service where we can provide that verification in writing on the spot, wherever we are, or remotely. I've also offered a remote service. If our worker's not there, they email us and they get that verification for that person who's sitting there at the moment. It's usually a quick turnaround with an entire team that's watching that email on a rotation basis all day long. We have crisis intervention. So if somebody comes to our workforce system partner and may have some barriers, or if we identify our client has barriers, we do have a social work unit that we refer our clients to in case they have domestic violence, substance abuse, mental health issues, homelessness, etc. And we're able to help remove that barrier to try and get them in the direction they need to go in for success. We provide workforce development unit provides case management from intake. As soon as we meet a customer, up to 1 year of job retention services to make sure that we get them a job that's right for them, and then through 1 year of job retention, stick with them through monthly or bi-monthly, depending on the need, calls and emails to find out how they're doing, seeing if there's a chance for upward mobility, keeping them in the job if something goes wrong, offering them referrals, support services if we're able to provide it. And sometimes we even try to make sure that there's a chance for upward mobility, or offer them opportunities to train now that they've got some experience under their belt, so that at that 1 year mark, they're making more money than when they first got the job. So that's the long-term focus that we have in this unit. We also issue support services when the client qualifies on both TANF and SNAP, or we seek out resources in the community if we don't have that particular support service. We help plan and manage train-to-hire pipelines with our partners. So we'll work with CSN, other state schools, our WIOA partners, DEETR, to put together train-to-hire pipelines, find an employer or an industry that is in need, And we have tens of thousands, for example, of SNAP clients who may be job seeking, a couple of thousand TANF clients, and we have a large workforce pool that we're able to promote to and work to lead them to these opportunities and these pipelines, serve the employers that are in need and our job seekers that are looking for a career. And so some of the things that we can provide on the support service side, and we've been able to do this for a number of years. We've increased the amount that we can leverage these days. We pay up to $5,000 tuition for our TANF clients to for their vocational training or non-degree credentialing programs for a career. We'll braid funding with our WIOA partners. So our $5,000 on top of our partners' $5,000 or $7,000, we can pay for some pretty decent non-degree credentialing programs to get them to a living wage. We also seek out other grants and funding if in order to fill gaps when needed. We've used Sandy Grant under Dieter. We've talked to schools about their private funding, and we'll even help a client go after a scholarship if we need to. On the SNAP side, we have the SNAP ET 50/50 reimbursement program. And we're partnered right now with some state schools like CSN, Truckee Meadows Community College, Nevada State College. And anybody who's on SNAP, we can change them to SNAP ET, manage their case, and get their tuition paid for any programs that they might find that's right for them within those state colleges. And we still, if client's not a candidate for SNAP ET, we'll still partner with our WIOA partners to serve that SNAP individual. And so Title I will still help us out. We partners with the youth program, reentry, and Governor's Office of New Americans. And we provide the same holistic case management support to those SNAP individuals. And you might ask, what do I mean by holistic case management? So the Division of Welfare and Support Services, in developing our workforce development program, we're unique from our workforce system partners. We have a human-centeredness approach, which means according respect, acknowledging people's essential human dignity, treating people as individuals, and finding out what's important to them relevant to their treatment, their care, and their long-term career goals. And that helps us with try to ensure a higher success rate, because we want to lead that individual that we get to know to the right career path so that they're not wasting anybody's time, including their own, and they're going to hopefully get to a career that they stay in and are happy in. Holistic case management, when I say that, that is addressing end-to-end client needs, including their physical, their mental health, financial, social, and legal barriers, removing barriers so that they can be successful as well. So this is mostly how we differ from our other workforce system partners, because we're a social service agency first, and we put the unique needs of our and considerations of our individual customer and families first. Some of the additional support services that we provide other than tuition is for clients who are on TANF or in SNAP ET. In some cases, we provide bus passes, gas reimbursement, clothing vouchers, uniforms, books, DMV vouchers. We'll pay for their car registration, their state ID, their driver's license, professional licensure at the end of a certificate program. We'll purchase laptops so that they can get through school efficiently, and even pay for their internet usage. So where do we begin with customers? From an intake, when a customer is referred to us, the first thing we do is look for the barriers and try to remove those barriers or assist the client in those areas with the mental health, substance abuse, domestic violence, housing. And we take a look at their employment history. We address their soft skills, which soft skills are their character traits or interpersonal skills that characterize a person's ability to interact effectively with others. Employers report nationwide, the big reason that people don't get hired on jobs or don't keep a job is because of soft skills. So we have some soft skills assessments and trainings in place to try and ensure the long-term success of our clients. We assess their academic skills to make sure that they can make it through an academic course by using work keys and other academic assessments that we have at our disposal. And we do career exploration with that client to make sure through occupational assessments that they are going in the right direction for them. We also have job placement. We were given an employer relations specialist, and we partner greatly with Dieter in our employer relations. So with our TANF clients, we're able to offer on-the-job training. We will reimburse up to an employer up to $3,000 of the beginning wages for our clients. So it's one way of enticing employers to hire our clients and keep them long-term. And the Workforce Board, Workforce Connections, Title I, Dieter, they help us a lot with these things. There's WEX that they offer our clients as well, and help us bring our clients to the employer. If one of our clients signs up with on Employee NV, it finds a job that they're suitable for, our partner knows and trusts that we're going to develop them for that, and they feel confident in reaching out to that employer and asking if they'll consider our client for an interview. And Dieter has helped us get a lot of our clients hired. So I mentioned the job retention services. Wrapping it up here, entry points are, like I said, where can you find us? 9 Employee NV hubs. I'm going to put our email in the chat. We have a team that answers our email inquiries on a rotation to make sure our customers are responded to every day. And that email is simply workforcedevelopment@dwss.nv.gov. We're in the process of getting a new main phone line because we just moved to the Owens office. So I'll not put the phone number in there at this point, but you can reach us through that email or any of the Employee NV hubs or the Owens Welfare Office, or any office of welfare would be able to connect you with us if you forget the email. But I'm going to put the email in the chat, and I'm going to thank you for your time.
Thank you very much, Mr. Yoder. It's always great to hear what the Workforce Development Unit and the DWIS team is up to, and appreciate all that you guys do. Do any members of the council have any questions for Mr. Yoder? Hearing none, thank you so much for your presentation. We really appreciate it and appreciate all the work that you guys do. With that, we can move into agenda item number 5, another Division of Welfare and Supportive Services, the Courtyard presentation. Do we have somebody from Welfare and Supportive Services that can speak to the Courtyard?
Yes, this is Richard Twyman for the record.
Awesome. Thank you very much, Richard. Go ahead.
Hi, I'm Richard Twyman. I am the Social Services Manager with Division of Welfare and Supportive Services. I manage the unit that we have at the Courtyard. So the Courtyard is a homeless campus that provides services to the homeless population. And we have a unit of 1 supervisor, 8 family services specialists or the caseworkers, and 3 administrative assistants. They are located right at the Courtyard to help the clientele exactly where they are at. As you know, this is a clientele without as many resources to get to an office. So if by us having our unit there, they can access and get their benefits a lot easier. I pulled some numbers over the last 30 days. We averaged about 46 cases a day in that unit, with a 91% completion rate. So that means 91% of the clients that came in to see us were given a decision on their benefits right there the first time they saw us. We didn't request any additional information to come back and to process the case. Majority of the clients, they are considered intake clients. They're coming in, establishing their food stamp or medical case, and getting their benefits, their case open for the first time. We have been there about 2 years. I believe this is a good example of Division of Welfare Supportive Services meeting the people in need where they are at. This is a transient population. However, it doesn't change overnight. So I've been out there on days and asked in the common area and asked the clients if they were aware that they had that there was a welfare office on the campus. Most of them already had their EBT card. They already had their benefits. So I believe we're doing a good thing and serving the population that is needed. And that's it.
Thank you very much, Mr.
Right.
Twyman. Senator Neal, you have a question?
Yes, thank you. So number one, thanks for being on the campus. Two, after they are identified and you do the intake and they get the EBT card, they get medical services, how are they then connected to the short-term housing? Is there a handoff? What's the continuum? Because I guess in my mind, I'm like, okay, so now they can get the food, but how are we mitigating them getting the EBT card, getting food, and still being on the street? Is there a connection to the Clark County service?
So they come in through they have a courtyard. They come in through the intake worker at the courtyard. The people at the caseworkers at the courtyard can direct them to the services that are on the campus, such as ours and their other medical services that they have. And I believe it's on an as needed basis. All of the services are on campus. And if they need directions, they have their social workers on site. They have their medical people on site, showers, and different caseworkers that can help them, that they then direct them to the how to get housing and things and the resources that they need. So that's
So,
more, excuse me, I'm sorry.
Chair, if I may, may I interject for a
Absolutely.
moment?
Absolutely.
So Robert Thompson, for the record, I'm the administrator for the Division of Welfare and Supportive Services. So we are, as Richard said, we are currently at the courtyard and we have our staff at the courtyard. Deputy Cantrell is currently working with our social worker team to place social workers. Currently, the social workers in the welfare division target only our TANF population. They have not been funded outside of TANF. TANF is families, children, people receiving the welfare assistance. But Deputy Cantrell is putting a team together to have social workers on site so that we can intervene and have licensed social workers to then take those handoffs that Richard was talking about so that we can, Senator, move them to the population and to the other agencies that are there. Currently, it would have to be requested, but we're working in our processes so that we can address it exactly as you're saying and do our best, especially those that have children there. No child should be living at the corridor. No one should be living at the corridor, but especially children. Director Whitley has been very passionate about that. So we are increasing our staffing and increasing our scope a bit more than we have in the past, and we should see those coming in the next couple of months once we get those social workers on board and fully trained.
Okay, let me know, I guess, when that happens, because I knew that was a gap, but I didn't know that's what you guys are moving in that space.
We haven't, Robert Thompson, for the record, we have not We didn't have requests from the corridor to do this. Deputy Cantrell took it upon herself after conversations with Director Whitley to carve out some of our social work positions to become more robust down there. Director Whitley, for those of you on the line that do not know, Director Whitley worked also with the Division of Healthcare, Finance, and Policy, so that if we are able to have housing insecure persons, our homeless population that need medical care services that would normally be done in a home, they actually received a waiver so that the homeless individual can use the homeless corridor or any homeless shelter as their address, so the Division of Healthcare, Finance, and Policy can pay those bills and have Medicare provider go out on site the same as they would in a home. That was a huge undertaking. So putting those services in place, the Division of Healthcare, Finance, and Policy, keeping our food stamps Medicaid population down there, adding in the TANF population for when families with children come in, and then we're going to also be increasing our scope to include the social workers. I think we're moving in the direction that you want us in. And we will probably be having more of those conversations, especially during session as we are putting our budgets in front of you.
Fantastic.
And yes, we
Sorry,
will.
Senator.
I will make sure that you receive emails regarding those updates, or we can. Chair, I would love to bring those teams in to present to this council on what they're doing once they expand those scope.
Absolutely, that would be great. Any other follow-ups, Senator Neal?
No, thank you. Thank you, Deputy Thompson, for the work that you guys are doing. We'll definitely talk offline because there's some stuff happening that I would like your input on.
Sounds great. Lieutenant?
Good afternoon. Can you guys hear me okay?
You're a little bit quiet, but I think
I apologize. My mic has not been working very well, so I apologize. Is that better?
it's a little bit better.
Okay. So I just wanted to ask, I recently able to get one of my deputies certified and then sent him to Oklahoma to be in the area. So I'm really excited about that. So I wanted to know, as far as and this is for you, Richard, at the Courtyard, do you guys have a SOAR? So are you guys successful with that and able to housed able to get them the disability or SSI, SSDI?
I'm sorry, I didn't hear the question. You broke up some.
Chair, my agency is the one that's over Richard's, our social services manager, Twyman's operation down there, but I'm really having trouble hearing the question.
All right. I apologize. I might have to send this in an email. Still hear me or no?
I can pick up. I'm trying to lean really close into the mic. Let me turn my speakers up. Oh, they are up as loud as they'll go.
It's not, you guys. My speakers, they just fixed them today and it seems like they're not working.
I'm picking you up a little, somewhat. Go ahead and try. We'll try again.
Okay, so is that a little bit better?
A little.
Okay, so I'm just wondering if the Courtyard has a SOAR representative, and if so, has it been successful?
So, Richard, can you answer that, or do you want me to jump in?
Yes, can you jump in?
So the welfare Division of Welfare, and Robert Thompson for the record, the Division of Welfare and Supportive Services social workers are able to be certified for SOAR. And for those on the line that aren't aware of SOAR, SOAR is the certification that allows our staff to assist individuals with applying for SSI. Those individuals that are disabled, that have not paid enough quarters into Social Security to receive survivor's disability insurance. Eligible U.S. citizens, eligible Nevadans who cannot have not paid enough quarters in, can receive supplemental security income, also known as SSI. Currently, we only have one social worker in the welfare division who is certified. Deputy Cantrell is working with that team to re-engage the SOAR program. I will be reaching out to her to make sure that the social worker assigned to the corridor is SOAR certified. I could not speak to if the other agencies, I mean, we're one small agency down at the corridor. We've got our dozen or so staff working down there doing the food stamps, Medicaid, and cash assistance. I can tell you that my staff down there are not SOAR certified because only social workers in our agency are SOAR certified. But we can look into that and report back on, I mean, we would have to ask the others and just kind of do an informal survey asking around. But I can tell you that we are going to make that one of our focal points. UMC Hospital reached out to us recently and said that is a huge barrier for the homeless population, is that they are not able to get through the SSI process when they're disabled because it is so complicated, and we want our social workers to be able to assist.
Thank you.
Perfect. Any additional questions from Mr. Twyman on their work at the Courtyard? Okay, hearing none, I think thank you very much. It is again very much appreciated the work that you guys do, and look forward to hearing more in the future about the work at the Courtyard. With that, we can move into agenda item number 6, Interagency Advisory Council on Homelessness to Housing Subcommittee for Technical Assistance. I believe this page was on. Brooke, are you available to give a quick presentation? You're still on mute if you're hearing us. Okay, not seeing this page come off mute. I think we'll move on to agenda item number 7 real quick, and we'll come back to 6 when we're done with that one. Michelle Fuller-Hallauer was not able to join us today, but did send in a quick thing that she wanted me to read in. The TA subcommittee continues to work on completing the action plan to accompany the state strategic plan. And they will also be presenting at the statewide homeless conference in Las Vegas on October 7th through 8th. And we'll be discussing the top 3 action steps for each of the strategic issues in the strategic plan in an effort to keep the public informed on the progress and solicit any feedback. And I think does anybody have any questions on agenda item number 7? Okay, we'll move back to agenda item number 6. Brooke, Paige, are you available to give us an update? If not, that's okay. Okay, with that, I think we'll move into agenda item number 8, discussion on agenda items for the next meeting. I believe that date is to be determined, but I know that we'll probably have an agenda item for the housing division on the AB 310 implementation from Administrator Acroft. Is there anything else from the team they would like to see on next agenda?
Hi.
Go ahead.
You are adding in what Deputy Director Thompson mentioned, right, about Cantrell?
Yes, we'll work with Administrator Thompson to figure out what maybe is timely to be discussing there.
Okay.
As well.
And Chair Rob, for our agenda item, the update on 310, if you could make it for possible action, dependent on when we receive applications, this body is to assist the division in reviewing them. I don't know that that will all happen by the next meeting, but certainly would like to have the ability to do so if it does.
Sounds great. We look forward to participating in the process. Any additional items? Okay, hearing none, we'll close out agenda item number 8 and go into agenda item number 9. This is for general public comment. No action may be taken upon a matter raised under this agenda item until specifically added to the agenda. Comments are limited to 3 minutes. If you're making public comment via phone, please call 1-775-321-6111, and the meeting ID is 142-618-828 followed by pound. We're now open for public comment. Is there anybody on the line that wishes to make public comment? Give it just a second in case folks are dialing in. Okay, hearing none, I think we can move into agenda item number 10. Do we have a motion for adjournment?
I will motion for Robert Thompson for the record. I will motion for adjournment.
Awesome. All those in favor?
Aye.
Aye. Aye.
Okay, I think at that we are adjourned at 1:51 this afternoon. Thank you all for joining today. Appreciate the presentations, and we will be in touch about the next meeting soon.
Thank you.
Thank you.